So basically, diabetic mellitus. So basically, there are two types of diabetes mellitus. Means yesterday we talked about pancreas. So basically, pancreas produce two types of uh, three types of hormones. Basically, two are very important. That is glucagon and insulin. So insulin is very important for us because it will restore the energy. It will store the energy, okay, into the cells, and cell will utilize it, or maybe it will store for future purpose. So what will happen? It is diabetes. So basically, in diabetic one, what will happen? The cells which produce insulin, what are the cells? Beta cells. So where are the beta cells? Beta cells are in islets of Langerhans in pancreas. So basically the beta cells, or maybe it will damage, or it will not produce insulin. Okay. So if the insulin is not produced by the beta cells, or beta cells are damaged, or islets of Langerhans are damaged, so basically it will insulin is not present into the blood. Okay, it will not release into the blood. So what will happen? The glucose which are coming into the blood, it will not enter into the cells. So cell will not get glucose. Okay, what will happen? They will not get energy, and the function will affect. Okay, so see, this is basically type 1 diabetic mellitus. So how it will happen? What are the reasons behind that? So the basic reason is it will due to our immune disorder. Okay, so first reason is it is autoimmune disease. Means our own body cells identify that these cells, what are those cells? Beta cells. Okay, it is damaging our body. So what will happen? Our own immune system will attack on the beta cells. So beta cells will die. Okay, so the it will by mistake our own body cells will uh, attack on the beta cells. So here we have the given that uh, other things, what are the clinical things which are happening nowadays. Okay, there may be a genetic predisposition. So other reason is genetic disorder. Okay, from mother, father. Okay, the uh, hereditary response, it may be one of the cause. Okay, insulin by injection, inhaled insulin is undergoing clinical trial, is essential to control type 1 diabetes. Research is continuing on the use of immunosuppressant medicines to try the to preserve some beta cells if diagnosis is early, and also on the transplantation of stem cell to replace lost beta cells. So basically, what are the treatment options are there? So basically, one option is the clinical trials are going, so they want to inhale the insulin by nose. Okay, so likewise, we smell anything. Likewise, there is a medicine we will insert into our nostril. So we will press and it will enter into the stomach. Okay, okay. So this is the one of the trials are going on. Second is immunosuppressants. Means during in initial stage, if we identify that the person have type 1 diabetic mellitus, okay, what will happen? It will our own immune system is damaging the beta cells. Okay, so what will we give? We give immune suppression. Means we have to suppress the immunity, then the immunity will not attack on the beta cells. Okay, this is the second option. Third option, we have stem cells. Stem cell therapy is very costly. Okay, means the whatever the stem cells are stored into the bank, stem cell bank, we have to release that stem cells and we have to insert into the body. Then the regeneration of beta cells will happen. Okay, these are the three or four types of uh, treatment option in modern medicine. Okay, but in electrohomeopathy, we have very good treatment for diabetic 1 as well as diabetic 2. But we need patient for the treatment. Okay, because it will take mm, longer time to regeneration the beta cells. Okay, to take the regeneration of beta cells, so patient will take more than 1 and 2 years. Some patients will recover in 6 months also if we give electrohomeopathy treatment. So in the treatment option we will study about the electrohomeopathy treatment. Yes. Next we have type 2 diabetic mellitus. Here yeah, here we have the given that type 1 and type 2. Okay, so basically this is the insulin receptor. Sorry, this is the insulin receptor. Here we have the insulin receptor. Here the we didn't have insulin receptor. We have insulin receptors but decrease. Okay, so what is the type 2 diabetic mellitus? Type 2 diabetic mellitus means there are the insulin, but large amount of insulin is not present, but beta cells will release the insulin. Beta cells will work, but the insulin will not remain in the blood. Okay, understood. So basically what will happening, that that blood, in the blood goes insulin are there but not large amount. Okay, so what will happen, the blood glucose, the glucose present into the blood, it will go to the kidney. Okay, from the kidney large amount of glucose is released to the urine. Okay, okay, so for this we have the patient will complain about polyuria. What will he do? He will complain polyuria means, I have large amount of urine. I am going urine multiple times, doctor, in mostly in the night. Okay, I have thirst. Why this happening? Because the glucose is going to the through the urine. Okay, so what will happen if it is present in large scale? The patient have hyperglycemia. So this condition is now also known as hyperglycemia. Means the amount of glucose is high in the blood. So this condition is known as hyperglycemia. Okay, so what will happen? So the patient have multiple things. Multiple things will happen. What will happen? Their skin will damage. Okay, it will affect to the retina in the eyes. Okay, it will affect the neuro nerves. It will also affect the kidneys. Okay, multiple things will happen, and some patients will have the glucose will cause uh, infarct, means clotting, blood clotting. It will also damage if any heart attack. It may be uh, neuro disorder will happen. Okay, so these are the multiple complications of two diabetes 2 mellitus if it is not treated. If it is not treated. Okay, so what will another type of problem, that is ketoacidosis, means it is in type 1 or type 2, both will ketoacidosis is seen. Okay, uh, it will we will talk later in uh, medicine. Okay, because it's vast subject. Okay, but first here I am giving the introduction of type 1 and type 2 diabetes mellitus. So next we have endocrine gland, that is adrenal gland. Okay, yesterday we talked about pancreas. In the pancreas we talked about uh, glucagon and insulin, and another uh, hormone also we studied, that is uh, cortico ex- somatostatin. Sorry, somatostatin. Okay, delta cell will produce somatostatin. Okay, next we have adrenal gland. Basically, it is present on the top of kidney. Okay, so this is the kidney. This is the in the top we have adrenal gland. Adrenal gland will produce two types of hormone, that is norepinephrine and epinephrine. Epinephrine and non-epinephrine. So we will talk about detail and other hormones also there by the adrenal gland. Okay. So basically, the adrenal is divided into two parts. Okay, we have to understood that. That is medulla, adrenal medulla, and outer adrenal cortex. So each part will produce different types of hormones. So uh, adrenal medulla. So let's see the image. So basically, this is the adrenal gland which is present on the above the kidney. Okay, so this is the kidney. Above the kidney, you have adrenal gland. If we cut the this cut section, we have inner and outer. Okay, so this is the cortex and this is the medulla and cortex. Okay, you can see in this image also. This is the adrenal gland. You can see in this image also. This is the cortex. Okay, this is the medulla. This is the cortex and medulla. Medulla, inner and outer is cortex. Outer is cortex and inner is medulla. So basically, inner will release different hormones and outer will release different hormones. Means medulla will release different hormones and cortex will release different hormones. So we will study here. First, we will talk about adrenal. Sorry, we talk about medulla, inner. Okay, inner. The cells of adrenal medulla secrete epinephrine and non-epinephrine. So what will it will release in the blood? It is two types of hormones. One is epinephrine and another one is non-epinephrine. One is epinephrine and another is epinephrine, non-epinephrine. So basically both are called catecholamides and are symptomimetic, also known as catecholamides and sympathomimetic catecholamides. So basically epinephrine and non-epinephrine. Okay, so let's talk about epinephrine and non-epinephrine both. So basically, these hormones stimulated by sympathetic impulse from the hypothalamus in their functions duplicate and prolong those of sympathetic divisions of the autonomic nervous system. Okay, basically this function is per sympathetic pathway. So basically sympathetic pathway is the pathway we need fast acting. For fast acting, sympathetic pathway is used. Sympathetic pathway is utilized. Okay. Now we talked in neurological physiology. Okay. If you want to realize, want to repeat, you can watch the video. Okay. So epinephrine and non-epinephrine means whenever a condition is needed, you want to act very fastly, very rapidly, or fighting condition. Okay, so this condition needs sympathetic pathway. In that condition, epinephrine or non-epinephrine will release. Epinephrine is also known as adrenaline. Norepinephrine is known as noradrenaline. Okay, secreted in stress situation. I told you na, fight or flight condition. Okay, norepinephrine is secreted in small amounts. Its most significant condition function is to cause vasoconstriction in the skin, vice versa, and skeletal muscles, that is throughout the body, which raises blood pressure. So here we will see the diagram. With the diagram, with this with this diagram, you can understood easily. So here adrenal medulla is there. Okay, it will releasing two hormones, norepinephrine and here norepinephrine, epinephrine. So after releasing, what will happen? It will constrict the skin and constrict the other internal organs. Vasoconstriction is skeletal muscle. Okay, okay. This is for norepinephrine. This will slightly do, but epinephrine when released, what will happen? Heart rate will increase. Well, our lungs will dilate. Okay, and glycogen to glucose conversion is very rapidly happen, and fat to fat is utilized for energy, and cell respiration increases, and as well as what other things happen, vasoconstriction also happen. Okay, decrease peristalsis movement, mean what is the movement of the blood and other things will decreases. Okay, vasodilation is convinced skeletal muscle, more amount of energy is utilized by muscles. So why this is happening? Because you have to fight with this condition. You have to fight or fight with this condition. Okay, like when you want to run, what we'll need? We need epinephrine. So epinephrine will rush into the blood cells. What will happen? The hormone is released from the adrenal medulla. So what we'll do? We will run. Okay, whenever you will get angry, so it means some amount of epinephrine is released. So you act fast, you answer fast. Okay, sometimes you will bite anyone. Sometimes you will kick anyone. What will happen? Because of this epinephrine. So this will utilized in special conditions like flight or fight. Okay, so these are the two things you have to remember, very important. So basically what will happen, the patient's BP or anything will decrease. What will happen, we will uh, give adrenaline in the emergency room. Okay, not by our doctors, but uh, anesthetic doctors, emergency doctors will give adrenaline in the uh, emergency room, emergency ward, ICU, or casualty if necessary. Okay, so basically, so these are the things we talked about. Tomorrow we will talk about the functions of cortex, medullary cortex. Okay, adrenal cortex. Okay, adrenal cortex will study tomorrow. Okay, so if any doubts, you can ask. Thank you.